I have come this close to dying, and I had 3 children sleeping, and I broke a chair trying to save my life. Now I know what to do. Nobody
It
said
act
anything
Erica,
before.
it actually can even improve, and I know you're gonna thank me later. You're only in week 7 of the program. You're gonna thank me later. People with Hashimoto's can have actually a lot of swelling in this area with their thyroid going in and out. How many people out there, how many people have Hashimoto's type in the chat? And
Mhm.
how many people with Hashimoto's have discomfort and swelling around the neck that you're like, oh my God, I didn't even know it's related.
Yeah,
Now,
people are saying, "Yep, that's me."
yeah.
Absolutely.
Well, and then there are these disorders like there are a syndrome we call burning mouth syndrome.
Mhm.
So there are people with burning mouth syndrome where the mouth really burns, and then that can impact upon the swallowing. So lots and lots and lots of diagnosis. And a
Mhm.
lot of people are like, I'm going to see an endocrinologist for my Hashimoto's, and yet they're sitting here dealing with like voice or swallowing problems. And the endocrinologist is like, oh no, it's not related. Let's go somewhere else. Let's scoot you to another specialist. And I cry bullshit on that one. Okay, because it absolutely is just another target of autoimmune attack with which thousands of solutions exist. And we're going to have 3 alumni that we're going to be bringing on pretty shortly. But I do want to jump into what's causing this. Why do
Okay.
people with autoimmunity get this so often? And I'm going to tell you guys right now, if you have not watched the 5 pillars training, please put 5 pillars in chat because I actually go over it in every pillar. What is the underlying things that are feeding autoimmune disease? And every one of those pie pieces of the 5 pillars has something to do with these symptoms. So I'm curious, Erica, you came into the program with no diagnosis and
No.
you had a mind blow on Tuesday night. What did you learn, Erica, on Tuesday night?
Well, I had actually delayed sending him because I thought, "No big deal. The blood work isn't gonna show anything." And then I did, and and you were like, "You have Hashimoto's." And I was like, "Wait, what?" And like, well, not only that, I mean, that I that data has been sitting in my data from my doctors, and nobody has said anything. Why is that? So I bring it to you, and you're like, "Boom." And then I look at the symptoms, and I'm like, "Holy freaking are you kidding me?" Like, it's like boom, 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 boom. I'm like, "This is insane."
It is. It makes me mad.
It makes me mad too.
It makes me mad. And it makes me mad that somebody has been having the list of symptoms Erica had, plus she had the choking and throat problems. Anybody with choking and throat problems, why the hell wouldn't you test them to see if they have an autoimmune disease of their thyroid, maybe causing local swelling even?
I've
And
literally
Which gets the timbre of her voice changed.
Oh, yeah.
thyroid function. Listen to her voice right now. See how low it
Yeah.
is, right?
Yeah.
It's part of her autoimmune disease, right? But the other thing, Barb, is this. I don't even know if anybody has ever tested her for Hashimoto's. And if they did, a lot of doctors say, I don't care. It doesn't matter. It doesn't change my treatment of you. Who cares if you have Hashimoto's or not? I don't know if she's in that category or not. But some people may have even had the testing and had it be positive, and just have the doctor say, yeah, doesn't make a difference. I don't care. It doesn't change. It's just medication changes. Bullshit. There's a big difference when it's an autoimmune disease of the thyroid versus regular low thyroid. Huge, right? And by the way, this was an accident. So what happens? We already planned this topic. Erica finds out that she has Hashimoto's and she's feeling very emotional. And then she says to me, can I add an extra question? I go, of course. And she said, do you think my swallowing had anything to do with my Hashimoto's autoimmune disease? And you could have heard a pin drop in that room because the answer is yes, yes,
And hell yes.
hell yes. And the layers of dismissal and the denials and
And man, I have tried everything. You know how many swallowing studies I've had? How many ENT appointments? How many allergists? How many times I've had to get the Heimlich because it's gone down the wrong tube.
and that's life threatening, guys.
I
Every time she
literally
had
broke a
Heimlich,
chair.
she was almost going to die.
I have come this close to dying. I was alone
Hmm.
and I choked on something and I literally broke a chair and I had 3 children sleeping, and I broke a chair trying to save my life, and I did, thank God, but it's very, very scary.
I remember telling my husband, I know I'm going to die choking. That that I've said that for so many years, and things are better. They're, you know, they're better. So it's great to know that there's a good future.
100%, and that's the thing is now I know what to do. Nobody said anything
Erica,
before.
it actually can even improve. And I know you're going to thank me later. You're only in week 7 of the program. You're going to thank me later. Don't believe me, everybody. Thank me later, right?
I'm
Let
thanking you
them
now.
share their journey. If you're someone that you think that you need help, you know you have these issues and you need help, type help in the comment section, right? And tell me what's going on. If you're on YouTube commenting, check your replies to YouTube, Instagram as well. Check your messages from us because I would love to share all these resources that we have with you.